Welcome to our channel. Today we're going to discuss a silent disease that affects millions worldwide called osteoporosis. Now you might be wondering, what exactly is osteoporosis? Well, it's a condition that causes bones to become weak and fragile, making them more prone to fractures. Picture a strong, sturdy castle slowly crumbling from within. That's what osteoporosis does to our bones. Now let's talk numbers for a moment. In America alone, this silent disease affects over 50 million people. Half of individuals over 50 who were assigned female at birth and 1 in 4 assigned male at birth are affected by this condition. So it's clear that osteoporosis is a widespread issue. But the good news is it's not an inevitable part of aging. Early detection of osteoporosis is crucial, especially for those over 65 or with a family history of this disease. Now that we know what osteoporosis is, it's important to understand what causes it. The root of osteoporosis lies in an imbalance between new bone formation and old bone resorption. The body may fail to form enough new bones, or too much old bone may be reabsorbed, or sometimes both. Hormonal imbalance can play a significant role. For instance, the decrease in estrogen levels during menopause is one of the biggest risk factors for developing osteoporosis. Age also plays a part, as bone mass typically peaks in our early 20s and begins to decline after that. Family history matters too. Those who have a parent or sibling with osteoporosis are more likely to develop it. Furthermore, a lack of calcium and vitamin D in the diet can contribute to early bone loss and decreased bone density. These nutrients are vital for bone health, as calcium is the building block of bone tissue, while vitamin D helps the body absorb calcium. These factors can greatly increase the risk of osteoporosis, but the good news is there are ways to manage and even prevent it. Osteoporosis is often known as a silent disease because it doesn't have any obvious symptoms. However, as the disease progresses, some telltale signs might start to emerge. One of the most common symptoms is an unexpected bone fracture. These fractures typically occur in the hip, spine, or wrist, often resulting from minor falls or, in severe cases, even from a simple act like bending over or coughing. Another symptom to watch out for is persistent back pain. This pain often stems from fractures in the spinal vertebrae, which can happen if the bones in your spine have weakened from osteoporosis. Now here's an interesting one. You might notice a slight decrease in your height over time. This is due to the gradual collapsing of your vertebrae as a result of osteoporosis. Finally, you might observe a change in your posture, developing a stooped or hunched appearance, often referred to as a dowager's hump. Remember, these symptoms often don't appear until osteoporosis has significantly advanced. That's why it's important to have regular checkups and bone density tests, especially if you're over 65 or have a family history of osteoporosis. Despite the risks, osteoporosis is a manageable disease with the right treatment approach. Treatment of osteoporosis revolves around a few key pillars, namely exercise, calcium, and vitamin D intake. Exercise plays a critical role in maintaining healthy bones. Weight-bearing exercises such as walking, dancing, or even climbing stairs can help to slow bone loss and maintain the bone mass you have. It's never too late to start, but it's always a good idea to discuss any new exercise regimen with your healthcare provider. Calcium is an essential building block for our bones. Adults should aim to get at least 1,000 milligrams of calcium daily, either through diet or supplements. Foods rich in calcium include dairy products, green leafy vegetables, and certain types of fish. Coupled with calcium, vitamin D is equally important. It helps our bodies absorb the calcium we consume. While the sun is a great natural source, vitamin D can also be found in fatty fish, cheese, and egg yolks. But it's not just about what you do, it's also about what you avoid. Limiting alcohol intake and quitting smoking can help to reduce your risk of fractures. Regular monitoring is also crucial. This includes bone density tests, especially for those over 65 or with a family history of osteoporosis. These tests can detect osteoporosis before a fracture occurs and predict your chances of fracturing in the future. While there isn't a cure, these treatments can significantly improve quality of life for those with osteoporosis. Osteoporosis might be a silent disease, but it doesn't have to be a silent struggle. Remember, it's a condition that weakens bones, heightening the risk of fractures. It can creep in silently, affecting millions globally, but especially those over 50. The causes range from genetic factors to lifestyle choices, and the symptoms can often go unnoticed. That's why early detection through bone density tests is crucial, particularly for those over 65 or with a family history. Treatment isn't just about medicine. It's about exercise, calcium, vitamin D intake, and regular monitoring. If you think you may be at risk, don't hesitate to seek medical advice. Thank you for watching, and please like, comment, and subscribe if you enjoyed the video. Also, don't forget to hit the bell notification so you'll be notified when we release new videos. See you next time.